The pandemic has shone a light on the growing mental health crisis, and at the receiving end are officers answering calls for help. It's a new reality many departments in Kentucky are working to address. In-depth reporter Christiana Ford explains what's happening and what they hope can make a difference.
For every call they answer,
911, where's the emergency?
it's estimated that at least 20% involve a mental health or substance abuse crisis.
I've seen an increase since my time here, and I would say since probably COVID, a tremendous increase.
Lieutenant Mitch Lair is a leader with Georgetown Police Department's Community Mental Health Team.
We have usually a new VISTA agent. We have civilian medical staff. One of our victims advocates is a certified counselor.
The uptick they have seen is being echoed across Kentucky. Of departments we reached out to, Richmond and Lexington police are also seeing an increase in the number of reported crisis intervention encounters.
They don't know who else to call, right? So they call us, they call dispatch, they call 911.
Over the years, Lair says they have had to shift their traditional role as enforcers, trying to support, understand, and help connect people to mental health resources that are out there.
I don't think we're at that social worker stage, like we can't be case manager for everybody, right? But I do think we can be a better steward of our community.
And departments nationwide and across Kentucky are leaning into that role shift, expanding their use of mobile crisis teams to respond to the mental health crisis. Quick response teams are in place in more than 25% of Kentucky communities, providing on-site crisis response, links to treatment, and overdose education. So people experiencing a crisis don't end up behind bars, dropped at hospital ERs, or worse, killed. And because of the increased need in many departments, the demand for mobile crisis teams and crisis intervention training is growing.
Kentucky's basic training for police cadets does include some crisis intervention, but nowhere near the 40 hours experts accept as the recommendation.
By law, the state offers that 40 hours for free, but officers or their leadership has to choose to sign up. The executive director in charge of the state program tells me most of the nearly 400 law enforcement agencies in the state have chiefs and sheriffs that have recently committed to having their departments trained. And classes for 2023 were filled in 2 days.
There's a tremendous need for training.
Mental health organizations like NAMI Kentucky partner with law enforcement to help train officers who get courses on subjects like introduction to mental illness, personality disorder, and medications. Strategic advisor TJ Lidovic says it has been working.
And it's had great success rates in many jurisdictions in reducing the number of arrests.
Reports filed after crises show that officers with intervention training were successful at getting people the help they needed without use of force 97% of the time.
It costs less to give somebody treatment than it does to incarcerate them. And it also reduces the number of officer-related injuries.
Lidovic says because mental health has become a part of the daily emergency response, what's really needed now is dedicated funding so that they can have the resources to keep answering the call. Christiana Ford, Evening Edition.